You know what they say on TV. Push one of Epi's stat.
Yeah, nobody actually says that.
Exactly. Welcome to the real world of nursing. I'm Millicent Olulade, better known as Nurse Millie.
And I'm Nurse Tara.
And we're surviving 12-hour shifts, nonstop call-lights, and pure hospital chaos.
And each other.
This is Shift Happens, where we talk about what really happens on and off the shift.
I'm your Nurse Millie.
And I'm your Nurse Tara.
And this is where we talk about what really happens on and off the shift. Follow us on all socials. The name is Shift Happens Podcast. It does, and you should follow us because, like, comment, and subscribe. Like, that's what the millennials are saying. Like, comment, subscribe. So why don't you just do that?
So why Shift Happens?
I think it's important to introduce Shift Happens to an audience because I feel like it appeals to healthcare providers and people that are not in healthcare. You know, like when you have your friends.
Okay, Millie.
What?
I'm not the interviewer.
No,
Tell me why Shift Happens.
Telling you.
The real nitty gritty reason.
So we're talking about, friends and family that are not in healthcare. So I feel like this is a way to explain things in layman's terms about what's going on and to also give us some grace. You want to know hey, I went to the hospital today and it was horrible. I'm going to give them horrible ratings. Why? I had to wait, 2 hours for my Tylenol. Well, you know why you had to wait 2 hours for your Tylenol? Because after I said, I'll be right back with your Tylenol, somebody coded. So then I had to run a code and then grandma choked on a pill. So then I had to burp her back. Then somebody fell out the bed. So I had to get them off the floor and then order x-rays to make sure they didn't fracture anything. And then somebody decided to wake up in delirium and pull out their IV. And I have somebody calling, ordering labs or a medication or asking me about, values. And it's like,
I thought it was because you were on a reality TV show.
Okay, well, you're messy. You're messy. Two things can be true. Okay. However, I just feel like it's important to educate everyone. And I feel like we're very relatable to nurses or other healthcare providers. What do you think? Well, since you know it all, what do you think?
I think that's important. And I do know it all. Thanks.
So what do you think the purpose of Shift Happens?
But I think it's good to talk about things that are really going on behind the scenes that everyone else is afraid to talk about. I'm not afraid.
A little afraid because I don't want to be unemployed. However, I think it is important to talk about these things. But in a lighthearted banter. Are you I feel like you're giving me very emo, very I want to be very serious and tell you the real.
Yeah, I want to get in and say things.
You want to deep dive in.
I want to deep dive in.
You want to scrub in. Things. You want to be sterile and you want to go all the way
I want it raw.
Well, I think that would be a nighttime shift happens. So let's call that night shift. Maybe we can do night shift where we talk about all the things Tara likes.
Oh, night shift. I worked a lot of night shift and it goes down.
It does. I'm a day
shift.
Shifter.
That reminds me of a funny story on night shift.
Okay. Tell me.
So we had a patient and at night, ICU patients have sundowners. When the sun goes down, it seems they go down. They start acting really crazy. They don't know what time it is. Mm-hmm. So one patient was in the ICU and he was having sundowners and he was screaming and attacking nurses. Ew. And we got on the intercom in his room and we said, "Hey, Mr. So-and-so, this is God. You've got to stop fighting your nurses and be nice and do what he says." And he looked around and he says, "Face me, God."
And he wasn't in restraints or anything.
No, it was the funniest thing. He wanted to challenge God and we all
then that's out of our hands, honey. That's out of our hands. You want me to tell you a funny story or no?
Yeah.
Okay, well, this was a day shift thing. I was in nurse practitioner school and I was doing my little clinicals. I had to see 40 patients and I was like, oh my gosh. So I got a stack of charts. Go through these charts. Tell me what your diagnosis would be, what your treatment would be, treatment plan, discharge instructions, blah, 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 blah. So my preceptor's like, there is 1 out of the 40 patients that has been placed in several nursing homes due to his inappropriate behavior towards nurses and excessive masturbation. So I was like, oh, okay. So I made note of that. Well, as I'm making my rounds, seeing all these patients, I'm like fumbling through my notes and I'm just kind of like winging it like, hey, what are you in for? I'm doing my assessment. I'm asking the questions. And the one thing she told me was when you go in the room, stay by the door. Do not get close to the patient because he will get aroused. And then he becomes like uncontrollable. So I was like, oh, okay, got it. So, of course, me being me, I'm your nurse, Millie. I go in there and I'm like, hi, how are you? How are you feeling? I sit on the bed next to him. I touch his leg and I was like, tell me how you're feeling. What's your day? Do you have any pain? Do you have any complaints? Is there anything I can do for you? Can I do a physical exam? And he just is going like this. And I'm like, does he have a history of seizures? Like what? And he's going. And I'm like, oh, are you okay? And I'm like touching his leg and he's going, and I'm like, oh my God, like, do I need to go? I need to get my preceptor. So I like back up to like go out of the door and go get her. Like something's wrong. Like, is he vagueling? Is he having a seizure? I see that blanket going like this. And I'm like, oh my God, I did something I wasn't supposed to do. Oh my God, like I went in there, he's aroused and now he can't stop. So then I went and found my preceptor. She's like, did you see all your patients already? I was like, no, I have 10 more, but I did something so horrible. I'm so sorry. She's like, what'd you do? I said, I forgot that you said that the patient in this room has, behavioral problems. And I went in there, I sat on the bed, I made eye contact, I touched him, and now he's in there just going at it. I said, I feel so bad. I triggered him. And she was like, oh my gosh. She said, it's okay. He was probably going to do that anyway. I was like, I just feel so bad. She's like, it's fine. I said, so what do I do? I didn't finish like my assessment and my question. She's like, I'll finish up for you. Just go on to the next patient. It was a little traumatic for me. I'd never heard. I don't even know what that diagnosis was, but I just felt really bad. Like
I said choking your chicken.
Is that the diet? Okay, fine. Choking your chicken. Treatment. Probably going to get discharged and have to go somewhere else. I'm so sorry.
Getting a lot of lotion.
Yeah, sorry. The good old hospital Johnson's & Johnson's lotion.
Okay, Diddy.
Okay. Oh, baby oil.
Yes.
Did you know baby oil really dries out your skin?
It does.
Mm-hmm. How do you know? Mm-hmm.
Diddy oil.
Night shift viewers. Tune in for Tara's nightlife expeditions. Yeah, we're like, okay. Do we want to talk more about why? We talked about why. Mm-hmm. So why do you think there is a lack of honesty in conversations regarding healthcare? Do you think it's taboo? Are people afraid that, I feel like people don't have social media. Everything's very private. I asked you and I'm cutting you off. I'm sorry.
Yeah.
That was really rude, but it's cool.
I feel like nurses and doctors are held in a certain esteem in society. So you don't want to tell the real truth behind some things because you have a reputation, and maybe if you're too truthful, doesn't come off as being so acceptable.
Okay.
So you don't want to show like your true thoughts on some things. Remember when someone was murdered and one of the doctors said something and he was fired for giving an opinion because maybe society holds them into...
That's true.
Holds them into a role that...
A certain standard. Like a professional standard. Mm-hmm. And, even though we're people, we still have, to have boundaries with what, our feelings and our beliefs and our thoughts are. We're still people. So what do you think a podcast such as Shift Happens creates for healthcare environments?
Well, I think we tell stories. We're here telling our funny stories. I feel like we're transparent in our own personal lives and our lives at work. So it presents a lot of transparency on what it's truly like to be a nurse, work in the hospital, taking care of patients, you're a nurse practitioner, I'm a nurse anesthetist, doing different jobs and how that translates into our daily lives and our work lives.
Yeah, I think that's important. And I feel like my inspiration came from COVID, right? So I feel like doctors are glorified, they're saving lives and they're doing all the research to come out with these protocols to help patients that have been diagnosed. But I feel like people realize that there are other forms of providers. Nurses, nurse practitioners, nurse anesthetists, physical therapists, occupational therapists, respiratory therapists. And so people are like, oh, I didn't know nurses do all that. Like, you are solely like the frontline workers. And so I feel like this is a good opportunity to introduce like what we do and, kind of create the balance of a professional yet personal perspective to share.
Sure.
Oh, the benefit of having a podcast like Shift Happens is that, yes, we have friends and family that we can vent to. But I feel like those long car rides home from work, it's like fun to hear somebody else's experience that may not be so personal to you or maybe similar to what you experienced that day at work, or maybe you have a family member that's a healthcare provider and this provides an opportunity for you to get their perspective as well. I know when I would come home from work, sometimes I would just sit in my car for like an hour and just like, okay, I'm going to listen to music. I'm going to do something. So I feel like it would have been
Just
really great.
decompress.
Yeah, to decompress. But also you have something that's lighthearted and fun and it doesn't have to be so dark. And it's healthcare related so you can relate or at least learn something in that time.
Yeah, I think it keeps it real, keeps it 100.
And authentic.
It's
almost like your internet besties. So
Yeah.
it's like, yeah, I don't really feel like talking on the phone to my friend or my coworker today, but I need to take this long drive home, stay awake, and then I might want to sit in the driveway or soak in the tub. Like that was one of the things I did a lot. Yes, people that are not in healthcare, this is very relatable because it's like, I feel like when you have those friends and families, they're like, what was work like today? What was this? What was that? Can you explain this? Da, da, da. I feel like we are giving you that access.
Access granted, and they can see exactly what's happening in our world. And it's fascinating, I think.
I feel like I got more questions about what nursing is like when we had COVID. Do you feel like that? I feel like people became more interested in nursing.
COVID, that was so traumatic and so hard. I cannot believe that was so long ago. This feels like yesterday.
It seems like yesterday. Yeah. I remember it more distinctly because I had 2 children during that time. And then with my husband being a physician, he was initiating the protocols for COVID. It was like a new thing. People were dying. And so he's like, I think I was pregnant too. He's like, I don't want to come home and spread something. I have no idea about the consequences. So there was total quarantine. And I'm like, how am I going to do this? I have 2 little babies. Like I'm pregnant. And it just really made me realize like how quickly the world can change, how fast healthcare had to catch up to stay on pace and save lives. And so that was one of the reasons why I didn't go back to work at that time because I had little kids and my husband was constantly working. What was your experience like personally?
I feel really that's what gets people interested about COVID because we really were headline nurses and doctors during COVID. So the outside world was really looking in on the healthcare, especially during that time. So I feel like that's why this podcast is really great because it gives
it was like an inspiration to start it. Yeah, COVID was like an inspiration to say, hey, here's a peek behind the hospital doors or the hospital curtain about what really goes on, the good, the bad, the ugly, and the in between. So what was it? I feel like it just changed overnight. I remember working on the floor and they'd say, oh, you shouldn't like put mask on if there's a smell in the patient room that's like offensive to the patient. Only put gloves on if you're dealing with blood or any other bodily fluids. Then, like within a week, it's like, oh, you're gowned up from head to toe, mask, shoe covers, gowns, just all sorts of PPE. And it's like, well, maybe we should have been doing that to begin with because we are working in a hospital.
Yeah, COVID was really crazy. I remember working as a nurse anesthetist, we had to intubate every single patient that had COVID in that hospital.
Why?
Because we're the experts on intubation.
Well, are you saying so was their airway compromised? And so was that just like your new protocol?
Well, the respiratory status was compromised.
Okay.
So they needed intubation because without it, they couldn't breathe. Yeah. So we had to intubate every single patient that came in with COVID, wearing our PAPRs, like on that movie Outbreak, how they're totally covered up. And to look at someone and know that they were going to die was very hard and traumatizing. Yeah. One time after I intubated someone, I walked up the stairs and I just cried because every time being called and knowing that they weren't going to live, because all the people that everyone was saying stay inside. Yes. They have diabetes, hypertension, all the comorbidities. A lot of the patients we were taking care of, they had all those comorbidities. So the chances of survival were very low. So COVID was really difficult. Yeah. Okay.
I feel like there was two types of nurses. There were the nurses that were terrified, afraid, and they just quit the profession altogether. There's also the nurses who were getting offered a lot of money to travel out of state and take care of COVID patients when all of this initially happened. Did you have any experiences or lose touch with close friends that made one choice or the other?
I feel like, your friendships, because you couldn't hang out with anyone, you really weren't social. But I do remember a lot of my friends going to New York and work. Yeah. And the weird thing about that, because it's such a big city, they were not taking care of patients like we were. Yeah. So let's say that someone needed to be intubated and they had a code blue where their heart stopped, they would do one round of CPR. Yeah. And normally we do 30 minutes of CPR, but because of COVID and they knew that the person was going to die, one round of CPR. And people that don't work in the hospital, they would never know that.
Isn't there like a shortage of ventilators or something like that? Like, don't you remember that? Like they were running out.
I do remember that because everyone was on the ventilator.
Yes.
It was just a bad time to.
I also feel like the conversation amongst nurses was two different conversations as well. It was like, oh, how could you just give up on nursing and like abandon your ship? Like you're horrible. Like, why are you leaving when things are so trying? And then there was other types of nurses, and this was all social media, but they'd be like, oh, well, why do you think I'm about to take care of patients and get sick and jeopardize my health and my family's health? So then it was like two groups formed against each other. And then I was just like, that's very interesting, because at the time I had two small children. My husband was a physician, so he was sleeping upstairs, changing in the garage.
I remember that.
Yeah, and it was just like, I saw both sides of it because I'm like, I get it. But
then you had some nurses being the sacrificial lamb, right?
Yes.
Where they're like, I'll take it for my patients.
Yeah. And somebody has to do it. Somebody has to do it. And it's like, my husband always says, are you the type that runs towards the fire or runs away? I run away from the fire.
Yeah, I run toward the fire.
I run away from the fire. I'll go get help, but I'm definitely not going back.
I feel like I'll run toward the fire.
Yeah, I run away. I run away. And then I go to Taco Casa. Is that inappropriate or? It's true. I stress eat, so I'm about to go to Taco Casa because it was a fire. I got help. I did what I needed to do. Yeah. Mm-hmm. Wakey. Are you guys still with us? I hope so, because you're still clocked in. But luckily for you, you get a 15-minute break, hydrate, and use the restroom. And then guess what? You got to clock back in and get back to work. Also, while you're on your bathroom break or snacking in the break room, stuffing your face with donuts from the kind patient, you are more than welcome to follow us on all socials at Shift Happens Podcast, TikTok, Facebook, and Instagram. Yeah.
Okay, Billy.
You know what? You do your thing with the bike. Let me do mine. Okay. So I want to talk about the stigma of catching COVID. You remember when everybody was starting to get diagnosed? Everybody was scared.
When you were coughing.
It's like, okay, I hear a cough. We need to back up. Are you completely 10, 12 feet, 15 feet away from me? Then your little friend from work You ain't been seeing her lately. Or your little, your friends outside of work. Like, where you been? I've been sick. You know what I'm saying? I think it's the flu.
They don't tell you.
You don't want to tell
They have the Rona.
Right. And it's like, well, you've been nasty. You ain't been following protocol instructions. You've been washing your hands, coughing on people, standing 2 feet away from people, breathing down people's neck. How you get COVID? Are you not social distancing? Oh, well, I don't know if it's COVID. Yeah. And then you get real, real sick. And we're like, yeah, you had that COVID. You had that COVID. I feel like I was a little embarrassed. Like, I remember when I first caught COVID, I was like, dang. I feel like I was like bitten by like a zombie. I'm like, oh God, I'm about to morph and transform. Like, and then it's like, well, you know what? I'll be okay because such and such had it last time. Or then you start gossiping with your friend, like, girl, you think she had
the OG COVID?
Yeah, I got the COVID vaccine. I did not
get the OG COVID, the original.
Oh, I got the original, but I was vaccinated before I actually got it. So you're talking about
no, you didn't.
Oh, you're talking about raw COVID?
Yeah,
raw COVID, no protection.
Yeah.
Oh, that was kind of one of your terms. Sorry, we'll save that for part 3 of Night Shift with Tara. I didn't. Did you?
No.
Okay, so we're very.
I got the watered down COVID.
I did too, and girl, the watered down about took me out. I think I first got it when I was pregnant with my 3rd child, like 6 months in. I thought I was going to die.
It was bad.
It was bad.
No herd immunity type of stuff. I feel like that's not it.
I don't think there was a herd immunity, right?
No,
I think after the vaccinations, people were not getting as sick. They definitely weren't dying because the death toll went way down.
Well, and I feel like that's where the education part comes in, right? Like, oh, I got the COVID. It's just like flu. I got the flu vaccination and I still have the flu. Well, there's different strains of flu or different viruses. Mm-hmm. So, oh my God, that COVID shot, why did I even get it? It's political. And you know what? You didn't die. Like, you might be sick. And yes, you caught COVID. But if you hadn't had that vaccination, you would have probably died.
Yeah, there's a lot of people that died from the OG COVID.
Yeah, so I feel like we should give applause to the vaccinations, and maybe that's a little opinionated for me, but I really feel like once people started taking vaccinations seriously, we saw the death tolls come down.
Yes, I believe in science. I'm a scientist, so I would have to agree with you.
Yeah, of course, and you should always agree with me, actually.
Because you're always right.
What were you? He said you talked about
something. My definitions.
Normally, we have one word per episode that we like to teach and educate our non-healthcare listeners. But today we dropped a couple bombs on you guys. So Tara, who's going to be your nurse, is going to give you a little patient education about some of the terms that we discussed.
So I think one of the terms was, I said PAPRs.
Yes.
And that is... I had to look it up myself because I'm so used to saying the acronym.
Yeah.
Powered Air Purifying Respirators, a PAPR. These are battery-powered, blower-driven systems that pull ambient air through filters, provide clean, breathable air to the user.
Okay,
so
perfect.
Every time we have to go in and intubate, we use those PAPRs.
Okay.
And then I also said intubation or intubate.
Yes.
When I have to go in and use a blade, laryngoscope to put an endotracheal tube into the patient's trachea to provide oxygen or anesthetic gas. That's an intubation.
Okay. I think you said PPE.
PPE, yeah. Personal protective equipment. So like your gloves, mask, gown, anything to protect you from the patient's bodily fluids. And then I also said comorbidities.
Yes, that was a good one.
And that's
very
the patient history, like if you have diabetes, hypertension, morbid obesity,
high
smoker,
asthma.
Yeah, just the comorbidities.
Things that can kind of bring down the quality of your health. Thank you guys for tuning in. We were inspired by what goes on behind the scenes, and we hope that we were able to inspire you to tune in and learn more about what goes on behind closed scenes in the hospital.
Because you know what? Shift really does happen.
It does, and we're going to talk about it. Even if we don't have a wet wipe or a bedpan, we're going to talk about it.
Agreed.
All right. That's your shift for today. You can clock out. And remember, I'm your nurse, Millie.
And I'm your nurse, Tara.
Take what you need and leave what you don't. And we'll be here to see you the next shift. I hope you're not late. You got to be there by 7. If you're late, then you get in trouble and then you might lose your job.
You might get a write-up.
Yeah.
All right, that's our time. The charge nurse is already looking for us. Thanks for working with us.
And if you enjoyed the episode, make sure to hit subscribe on Apple, Spotify, or wherever you listen.
And follow us at Shift Happens on Instagram, TikTok, Facebook, so you don't miss the chaos. I'm Nurse Millie.
And I'm Nurse Tara.
Please don't hit the call button. We are clocked out.